Hi everyone, my name is Parsa and I'm a second year medical student. Over the past year, I had the pleasure of working at the Diamandis Lab at the Princess Margaret Cancer Center in Toronto to help develop a new artificial intelligence pathology tool. So, in this presentation, I will be presenting OnSight Pathology, a real time computational pathology companion for histopathology. So, in terms of the disclosures, we don't have any competing interests to declare. However, on-site pathology and this video are both for research and educational purposes only. They are not validated for clinical diagnosis, treatment decisions, or direct patient care. Any clinical application must follow institutional policies as well as local regulatory requirements. So let's get started with the learning objectives. There will be three main ones for the purposes of this talk. First, we will explore the potential role of artificial intelligence in pathology. Secondly, we will be discussing current barriers for AI model and AI implementation in pathology. And lastly, we will define the requirements for a successful future AI model for it to be implemented widely in clinical workflows. So here is a visualization of the current digital pathology landscape. Unfortunately, the current AI landscape in pathology is highly fragmented. Different scanners produce varying file formats, and most AI models are compatible with only a limited range of these formats. This lack of standardization creates closed ecosystems that restrict interoperability across institutions, each of which may use different scanners, slide viewers, and ultimately digital workflows. Another major issue is privacy. Many of the current models require uploading sensitive patient data to the cloud, which raises understandable ethical and security concerns. In fact, institutions actively discourage or even prohibit physicians from sharing privileged patient data to external parties. To address these challenges, we developed on-site pathology. On-site pathology is designed to be highly flexible and vendor agnostic, meaning it works seamlessly across different scanners, file formats, and digital pathology viewers. We built it with pathologists in mind, allowing you to customize parameters like detection thresholds so the workflow adapts to your needs rather than forcing a one-size-fits-all approach. Importantly, on-site pathology also prioritizes privacy and security. It installs directly on your local computer, requires no internet connection, and keeps all patient data securely within your system. So there is no need to transmit sensitive information to the cloud. Finally, on-site pathology is built for real-time use. It processes slides in just milliseconds, allowing it to function as a true companion tool, something that integrates naturally into your daily workflow rather than remaining a research only prototype that would delay clinical workflows and take time to process files. So here is a quick visualization at how the on-site pathology workflow fits into your routine. Pathologists simply open their slides in their preferred viewer, select the region of interest, and on-site pathology analyzes it within milliseconds, all locally with no data uploads or internet connection required. Currently, on-site pathology offers three models: tumor classification, mitotic figure detection, and Ki67 quantification. So here is a quick demonstration of the tumor classification model. We will go through the four common CNS tumor types, and I want you to pay attention to on-site's red rectangle window on the right-hand side. And as you can see, for example, here is a epithelial tumor, and it was getting labeled as an epithelial tumor. Here is a glioma, and on-site is labeling it as glial histology in real time with a very high confidence score. So here is a more close-up or zoomed-in version of what was happening. On-site pathology was making inferences based on the tissue that was opened up in the digital slide viewer and labeling it as the correct histology type. For example, a meningioma case was labeled as meningoepithelial histology in with a very high degree of accuracy. Similarly, with a glioma case, it was being labeled by on-site pathology as glial histology, again with very high accuracy and in real time. So again, we also demonstrated two more cases. One was a schwannoma getting labeled correctly as a Schwannian histology. And lastly, we had a metastatic tumor, which was epithelial in origin. And it and basically we had it labeled as epithelial pattern. So in terms of validation, we have extensively validated on-site using over 1,000 TCGA cases and more than 1,500 cases from the eBrains European database. In the eBrains dataset, on-site was tested across a wide range of tumors, including various astrocytomas, gliomas, meningiomas, schwannomas, and metastatic tumors, and it consistently achieved high accuracy in tumor classification, as you can see from the confusion matrix. For example, we can see that the majority of ependymoma tumors were being labeled as glial histology, which is the correct tumor type for this category of tumors. Furthermore, our multi-class ROC analysis further confirmed this high performance by on-site pathology, showing an average true positivity rate of about 0.98 across all tumor types. So let's move on to the mitosis detection model. I want you to again focus on the red rectangle on the right hand side. And as you can see, as we scroll through the slide, we can see that OnSight is picking up mitotic figures and highlighting them in a green rectangle. For example, this one is being labeled as a mitotic figure with a confidence score of 85%, all in real time. So here again is a zoomed in version of what was happening. In real time, OnSight was detecting and highlighting mitotic figures as we navigated through the slide, updating the total count within each field of view. OnSight also includes an aggregate function that allows users to combine data across multiple regions, providing the total analyzed area and mitotic density per square millimeter. So in terms of the mitotic figure detection validation, we basically validated on-site against other models in the literature. And we can see that, for example, against models who participated in the ICPR 2014 challenge, on-site was getting a relatively similar performance to other models, and also the key advantage being that it is in real time and it is digital slide agnostic. And on the right hand side, we can also see the RC curve, and we can see a area under the curve of zero point 0.8 approximately. So moving on to the Ki67 quantification model, we can see again as we scroll through the slide, on-site pathology is picking up negative cells in blue highlight and labeling positive cells in red highlight. We can also see a positive percentage being reported, as well as the total number of positive cells and negative cells. So again, here is a zoomed in version of what was happening. On-site was picking up the positive cells in a red overlay and negative cells in a blue overlay. And on-site has been tested on a variety of Ki67 tissue slides. For example, on the left-hand side, we can see a tissue with a low amounts of Ki67 positivity. And on the right-hand side, we can see a tissue slide with a very high amount of Ki67 positivity. And in both cases, we can see that on-site was accurately picking up and highlighting cells as either red or blue, depending on if they were positive or negative. And again, we have an aggregate function where you can sum up regions, and it will give you the total number of positive as well as negative cells, as well as a percentage and the total area covered. So in terms of validating the Ki67 quantification, we validated on-site against QPAT estimates of Ki67, which is considered to be the gold standard. Furthermore, we also compared on-site's performance to DeepLeaf, which is another AI model that picks up Ki67 positive and negative cells. And as you can see, OnSight again performed with a relatively similar accuracy to both models. And the important part that I want to highlight is actually the box plots on the right-hand side. And you can see that while other models took much longer to process the tissue slide, OnSight was doing this in milliseconds. Since OnSight is adaptable for all file formats and viewers, we also wanted to test the hardware requirements. Specifically, we tested a variety of GPUs and CPUs, and the results are clear. OnSight works in milliseconds for most GPUs and takes only seconds for computers with just CPUs. This means that regardless of the hardware you're using, OnSight works fast and efficiently. So OnSight Pathology also offers a large language model for the users to chat with. This AI model is very beneficial for training purposes and offering additional insights on complicated cases where just a regular classification label might not be appropriate. As you can see, we can chat with the model and ask it to describe the tissue type. And the AI assistant will respond in one or two paragraphs and describe the histology present. So, knowing that many institutions do not use digital slides for diagnosis, we wanted to make OnSight relevant to traditional workflows as well. Using a microscope adapter that can be purchased from websites like Amazon for less than $20, you can use your phone's camera to adapt it for OnSight. Alternatively, you could also 3D print the adapter for less than $1. Here is an example from one of our early adapters. Simply place the adapter mount on the microscope eyepiece. Place your phone's camera on top of the mount and connect it to the computer. This will allow OnSight to analyze the slide, which makes OnSight compatible with traditional workflows. So here is an example of how the traditional workflow with a phone camera mount would look like. We can see that on the right-hand side that the tissue is being correctly labeled as a glioma by OnSight. Here is an example of how the mitosis detection model would look like with a phone camera mount and a digital work and a traditional workflow. As you can see from the inference window of OnSight, on the right-hand side, the mitotic figures are being highlighted in green and blue, and for example, the green one is being labeled with a confidence of 80%. So to summarize, current AI models in pathology have major limitations, such as privacy and security concerns, as well as not being in real time. However, OnSight was made to address some of these concerns, being very, being very, being very highly efficient and processing slides in real time in milliseconds, as well as working offline and only on your computer, which means that it doesn't require the transfer or upload of patient data to external organizations. So if you're interested in trying OnSight, please check out the link in the description. If you have any questions, please feel free to contact me at bavaiza@ualberta.ca. And I just wanted to thank the Diamandis Lab team for making OnSight possible.